Hello and welcome to the P&O podcast. This is episode 2. You haven't missed episode 1. It's just not been uploaded quite yet, so don't worry about that. It will hopefully be up in very soon. I'm very excited to be hosting Dr. Alix Chadwell today. She's a postdoc research assistant at the University of Salford as part of the Human Movement and Rehabilitation Research Group. So thanks very much for being with us today, Alix. We are going to talk about research that's going on there, and also hopefully things that are applicable to clinical work as well. We're going to be talking about activity monitors and their use in prosthetics. So Alix, perhaps you could tell us what they're used for and what they could be used for, maybe?
Yeah, so activity monitors is kind of an all-round term that can be used to encompass lots of different types of sensor that can be worn on the body or on a prosthesis day to day, and can provide copious amounts of information that can then be analysed and can tell us about how prostheses are being used, how the person's behaving. So people are probably more familiar with things like a Fitbit, where you've got an accelerometer on your wrist that is measuring the acceleration of the arm as it moves around. And that's the kind of activity monitors that I'm mostly working with, and are the kind that have been used the most when it comes to prostheses. So in the lower limb, it may be attaching an accelerometer onto the prosthetic foot or onto part of the thigh or something like that to understand how people are walking, whether they're getting up and about. They're mainly focused on step count related measures. So you can look at sedentary time versus how often people are mobile, and can then use that information to understand whether different types of prosthesis maybe get people up and about more often, or how their behaviour changes through the day. My research is more focused on the upper limb. So in the same way we use an accelerometer on the wrist, and if we put one on the prosthesis and one on the other wrist, we can start to look at measures of symmetry and how much someone is moving one arm relative to the other. You can start to look at whether the prosthesis is being worn, because you can look at whether it's stationary on the side or whether it's moving around as the person moves around. And you can start to look at how reliant the person is on their anatomical arm versus on their prosthesis. So it's measures like that that have kind of been used so far.
Okay, great. And so what sorts of things might you use that data for? What might that be used for going forwards?
So for me, for the upper limb work, we're looking at using that to try and understand potentially how different types of prosthesis are used. So at the moment, there's very little real world evidence of how people are using their prosthesis on a day-to-day basis. We can ask them, how often were you wearing your device? But we don't actually know during that time how much it's being actively used. So for example, we might be providing someone with a very expensive multi-articulating hand, but they may be wearing it, hanging it by their side all the day. But with someone with a cosmetic hand, you might find that actually that's constantly moving around and is reducing reliance on their intact side. So it's a lot of that is kind of trying to understand, can we reduce overuse injuries? We can use it when we're trying to do interventions. If you're providing people with a new device, we can look at how often they're wearing it, when they're wearing it, how that changes as the day goes on. Are there certain cultural reasons that people might wear their prosthesis? Is it that people are wearing it when they're going out and about and seeing people? Is it that they're wearing it during the periods when they're eating? So it gives us a lot more information than we've currently got just from kind of an average, I wear it kind of 5 hours a day. So it just gives us that in-depth information.
Okay, and in terms of sort of outcome measures and things for clinical work, do you think there's potential there that activity monitors could be used for that kind of thing too?
Yeah, so I think if you're trying to understand, there's a difference between how well someone is able to use their device versus how they're actually using their device. So if we're measuring someone's performance on, say, the box and blocks test or the Southampton hand assessment procedure, we're asking them to physically use their prosthetic hand to see how much they can use the prosthesis if they're kind of told to. But and this is probably something that needs to come more from clinicians in terms of what you're looking for, but there seems to potentially be a lack of a correlation between people's ability to use their prosthesis and how much they actually use it on a day-to-day basis. So I think it's the question to the clinicians is, what is it you're looking for? Is it that you're looking for someone to be able to use a prosthesis, or is it that you're looking for someone to actually be using that prosthesis? What is your outcome measure? So I think it's not necessarily a replacement of those outcome measures. It's an alternative way at looking at outcomes, more on a par with the wear time kind of questions that people ask. So looking at how often someone's wearing their prosthesis. But interestingly, at the moment, we looked at some myoelectric users and we found there's not necessarily a correlation between how much people wear their prosthesis and how much they use their prosthesis as well. So you might have someone who doesn't wear it that much, but when they are wearing it, it's really key to them. It helps them to fold things and put them away, do their washing, that kind of stuff, which is really key to them. Whereas someone else really wants it for the cosmetic benefits and does use the myoelectric features, but is potentially using it in a very different way. So just because they're wearing it all day, it doesn't necessarily tell us the full story. So I think it's more that this is a new type of outcome measure and a different way of looking at things. I think this is where we want kind of your guidance as clinicians.
Sure. And that makes sense, because as you say, there's a big difference between what can somebody do with a prosthesis and what do they actually do with it. And as you say, it makes sense that, you know, you need to decide which of those is more important. And obviously one is easy to see in a lab and one is not easy to see in a lab or in a clinic space. It's really what people are doing at home and when they're going about their everyday lives that I suppose is important. And that's kind of what you're saying, right?
Yeah, and I think it's really interesting because I think, so we've only at the moment started looking at some myoelectric users, and we've started to look at a few users of cosmetic and body powered devices in other countries. But there's very little data at the moment to be able to understand the different ways different devices are used. And I think it's very complex as to how people use different devices, because passive hands aren't necessarily not functional, and in the same way myoelectric hands may be used for stabilization a lot of the time, but actually for the small amounts of time people are using them for their full function, those people might find that really, really beneficial and can't do that without that device. So I think there's a lot of questions that are yet to be answered on exactly how these can be used, and I think we need to be careful and look around at the other functions as well as just arm movement.
Sure. The other thing I thought was interesting was, so often when we talk about outcome measures in clinic, we might ask somebody, or we might assign them an activity level, or we might ask them things like, you know, how many hours a day do you wear your prosthesis, or how far do you walk it, you know, what sorts of activities do you do? But if you were to take sort of activity data and compare that with a questionnaire, you know, one can verify the other, one can help interpret the other. So like you say, it's not necessarily a replacement, it's kind of a new tool that could be used for various different things.
And I think that's been used a lot in the lower limb, and I think with the lower limb there probably is more of a correlation, because if you're wearing your leg, you're likely walking around and using your leg, sure. Whereas with an arm there is much more of a kind of cosmetic aspect of it. There's many more people that are not necessarily just wearing an arm to get about and be able to do things. It's part of their image, and that is the case with a leg as well, but a leg is the difference between being wheelchair or crutches bound and being able to get up and walk around. So I think there is a lot still to be explored in the upper limb. It's a very new area of research. The work that I started during my PhD is the first that's been done, kind of looking at how prostheses are used for the upper limb using accelerometers. And there has been a small amount of work that's used cameras attached to the head to look at different grasps that are being used in very short periods, because video data is quite time consuming to analyse. And also there's been some that have had sensors integrated into the prosthesis to look at things like, if they've been implementing a sensory feedback mechanism, they've had logging of the on times, the off times of the sensory feedback mechanisms. But beyond that, there is very little technology that's been used to kind of do real world analysis of prosthesis use. So there's a lot of scope. We could look at pressure sensors, we could look at lighting sensors integrated into the socket to look at whether or not it's being worn. We could look at things like GPS that could help us to understand what locations people are using prosthesis in. I think there's a whole load of scope in terms of what sensors can be used. It's very early days. So.
Sure, but it sounds exciting. It sounds interesting, right? That there is potential there and there is technology available. It's just about how we decide to use it.
Yeah, and I think it's a really useful field to start looking into, because I think there's very little evidence on how some of these devices actually make a difference to the person, and this could help to potentially provide some of that data. But also, one of the big issues with a lot of outcome measures is the time it takes to assess them. And I know that the OTs are very short on time when they are seeing patients within a clinical environment, and activity monitors kind of offer us that ability to collect a couple of weeks worth of data and then take that back in, analyze it very quickly, and use it to inform discussions with the user. There's things where people might not quite remember all of the conditions. They might only remember the bad things that have happened, and that's all that they'll tell the clinician when they get there. Whereas actually, in reality, there may be a lot of other things that are potentially of use and interest to the clinician in making and informing their decisions. But if you could look at the data and you could go, oh, well, you did something really different on Friday, what was that? And then they tell you more about that activity, and suddenly that could give you information that you would never have thought about asking for. So yeah, there's a lot of potential.
Great. Yeah, that sounds really interesting. And yeah, that is the sort of, I guess when you talk to a patient, you are very reliant on them bringing things up in it to a certain extent, because you just don't know what sorts of things they get up to, or when they're using the prosthesis or whatever they're doing. Yeah, that's really interesting. What sorts of activity monitors are there? So you talked about accelerometers, and you mentioned sort of step counters. Are there other things as well?
Yeah, so a lot of the step counters are based off accelerometers. So you'll get an accelerometer which gives you your acceleration signals, and then there's a load of different algorithms that the software will implement onto that acceleration signal, and based on, say, thresholds or the orientation of the device or various different features, you can take out of that step count or whether the person's sitting, standing, lying. But then beyond that, you can also, there are some accelerometers that also come with gyroscopes. So the gyroscope gives you more of the angular momentum type information. Part of the issue with those is they are a lot heavier when it comes to the data logging and battery life. So with an accelerometer on its own, you can collect data over weeks and months, whereas if you've got a gyro in that system as well, you're reducing the amount of time that you can log data for. So I think it's a balance between what data is, what are you looking for, and how long a period do you want to log that for. If we logged for a couple of months, we could have things that were implemented and built into the prosthesis that potentially gave data onto a Bluetooth on your phone or something like that, and that you could start clinically to keep an eye on what's going on. So you might see that a person's use has dramatically decreased over the past week, and it may flag up something for them that says, has something changed? Do you think you maybe need to go and speak to your clinician? And these aren't things that are there at the moment, but these are things that you potentially could do if you can get something that's small, inobtrusive, and is just logging data. And one of the benefits of the accelerometers is they are just logging acceleration, so they're not pulling in loads of other information, so it's quite private. But then we can, as I said, go to many other different sensors. You could look at using things like GPS. Some of the accelerometers that are used in research do include things like lux sensors, so that's light, and your, I'm trying to think which other ones they had. So not many of them have pressure sensors in, but you could include logging of pressure. So if you had, for example, pressure sensors within the socket, you could start to look at whether or not that socket is worn based on whether or not you're receiving pressure against the socket walls. But then you can log things like your grasps, and with some of the multi-articulating hands, they are already logging aspects of which grasps they're using, how often they're being used. And if you could integrate that in alongside some of the accelerometry measures, you can then start to get more of an understanding of whether the hand is being moved in a functional manner or whether it's being moved passively, whether it's just arm swing. But then even things like arm swing are very informative, because if your arm is hung rigidly beside your body, then it's not feeling as much of a part of you. Whereas actually, if you're naturally swinging your arm, even though that acceleration isn't functional use of the arm, I think with a prosthesis, it's still very important to not just exclude that information and that data. And then, as I said before, there's things like system on-off times that are quite useful to log. You could, if you needed to, you could look at your EMG data and logging that. It's basically just any use of logging what's going on with the technology in the prosthesis. And yeah, taking that all the way from the multi-articulating hands, the myos that have all sorts of things you can measure, but even integrating some of that into some of the simpler designs, because they still have a lot of functional use that we could potentially measure. It's that balance you've got to find between, you don't want to cover someone in sensors because then they won't really comply and wear them and use them. So it's trying to keep it simple enough that people are happy to do things. But as soon as you're adding, because one of the issues we have with just simply with the accelerometers is if we put one on the prosthesis, as soon as they take the prosthesis off, we don't really know what they're doing with the arm. Now, we could put another one further up the arm so we could start to understand the differences between what they're doing when they are and aren't wearing their prosthesis. But then in order to match that, you'd have to have one exactly the same place on the other arm. So that's then potentially 4 sensors already, and just people don't want to put that many things on their arms. So I think it's finding that balance. I think we can do huge amounts of things, but I think the question is what do clinicians actually want and need in order to make their decisions? What are manufacturers trying to achieve with their devices, and what information do we need to work out if that is or isn't what is happening? And yeah, what do the patients themselves want to know about? Because sometimes some patients are really interested in knowing themselves what's going on, but also what are they willing to have in order to provide this information? So I think there's a lot of questions.
Okay, just going back to something you said about, so if someone you were talking about arm swing, if someone is wearing a prosthesis, and you mentioned, if they're swinging it perhaps in the way that they would with their anatomical arm, or if it feels a bit more, that can give you an indication of sort of embodiment and how much a part of them it feels. Could that also potentially suggest maybe what compensatory movement somebody is making? If they're not swinging one arm, are they, is there some other common compensatory movement that they might be making instead?
It could be. There's potentially things where you're absorbing that swing into the rest of your torso. And again, you can add accelerometers onto the torso as well to look at how much lean's going on. You can compare that to someone with both arms. You could look at the differences between someone who has lost their arm quite high up versus someone who's got very low level of limb absence. And yeah, you could look purely at torso lean and torso swing. So I think there are lots of areas that you can look at there, and you can start to understand what impacts these things are having when you're not just sat in a lab kind of just undertaking a task. Because yes, we can measure how much someone leans as they try to do certain tasks, but the bigger question is, how is that actually impacting their day-to-day life, and what knock-on impact will that have on them having future injuries? Because I think that's the way that you'll actually be saving money in the long run to the NHS, is by reducing some of those additional compensatory injuries.
Sure. Something else that I wanted to ask you about, I know this is kind of out of your area of expertise, but do you think there's potential also to look at sort of maybe rehabilitation more holistically? So, you mentioned occupational therapists earlier. Obviously, physiotherapists work closely with amputees, or particularly with primary amputees, or that there's gait training for somebody who's got a new prosthesis, or as a primary patient. Do you think there's a potential there for, so say somebody's been taught some exercises in a session, and quite commonly they'll go home, they might come back a week later or whatever, and in the meantime they've been doing these exercises. which is great. But of course, they don't get any feedback on those exercises whilst they're at home. That's the advantage of having a therapist. They know what they're looking for. They can make suggestions. They can tell you if you're doing something right or wrong. Do you think there's potential to use activity monitors for that sort of thing as well?
I think that, yeah, so there is already, I think, a lot of work, especially within the lower limb area, of starting to use accelerometry to confirm whether people are doing tasks. And on a kind of broader level, you see sometimes people are sent home with the kind of gamification stuff, where you have online games where the movements you're making affect whether or not that game character will or won't be able to do certain things. So you may have people, for example, having to look at range of shoulder movement, and by moving their arm to certain positions, they've got an accelerometer on their arm that's potentially measuring where in space their arm is. And I think a lot of things like Connect are used for that kind of measurement as well. But then even broader than that, this is an outcome measure has been used beyond just prosthetics. So there's a lot of people within the stroke field that are similarly looking at when people are going home, how are they using their arms? Because it's all very well, but if you're told to use your arm, you potentially can. But if it's harder for you to use it to go and open a door, then you're not going to, even though it might mean your activities are slower. So I think things like this potentially, there's probably at the moment we're looking more at a holistic kind of overall, what's your symmetry like, but there is the potential to develop measures that look specifically at certain tasks. So for example, if you're brushing your teeth, that's a very repetitive movement in a certain way, that it's potentially possible to look into that data set to pick out when they're doing that specific task. So it's the same thing that happens with fall detection, is they're looking for the pattern that tells you that someone has gone from a standing position to a lying position in a certain manner that suggests a fall. And we can develop these kinds of things that could look at certain tasks that potentially, even not whilst they're doing their exercise, but you could look at, has that changed how often they're doing that task during a week or something. And I think we're a bit of a way off having those measures in place, because you need a lot of in-lab development. You need people to do those tasks a certain number of times with you knowing that's the task they're doing. Because this is one of the issues with my own data set, is there's loads you could do with it. It's a really useful data set, but we don't have accurate diaries that tell us step by step what the person was doing every hour of every day. But if you can start to have gold standard data where you know exactly what's going on because you've videoed it happening, you can then start to use those patterns that are identified in the data sets and then try and find those within a larger data set.
Sure.
Yeah, so I think it's a bit of a way off having the software actually implemented and in place that can be used in labs straight off. But some of these more basic level stuff, so even like the symmetry stuff that I'm looking at, we're starting to try and get that to a point where if we can get it into some software that's available in clinics, people can start using something, and then you can start to implement the more complex algorithms as you go forward. And yeah, I think this is exactly where knowing what people are looking for really helps us to inform where we go with all of these measures. I'm quite keen to kind of build a group of people that can help to kind of guide what they want these measures to be. Because I think we are at that stage in the thing where there's a lot of people that are keen and interested to do stuff, but if we can make it clinically applicable, I think that's key.
Sure. Do you think, obviously, based on what you've just said, certainly not within the next few weeks or months or years, but do you think eventually it is feasible that this sort of thing could be done routinely in clinics, in terms of sort of the practical aspect of time and things like that? Do you think it is achievable long term?
I think, yeah, I think we're currently in some clinics, we are using outcome measures already at certain stages. And these outcome measures can potentially take less time. I think if the patients are keen and willing to wear the sensors that would be needed, or if they are integrated into the devices, I think there's no reason that they couldn't be used in clinic. I think some of the stuff with the multi-articulating hands, there are already cases where people may go and then plug that back into the software that's come with the hand, and it will inform them some of the information about the grasps that have been being used. And yeah, I see no reason that this can't be something that's a very quick bit of analysis that informs clinicians and helps them to guide their decisions and make their decisions. And I think we're keen to try and move forward to speak about whether or not we could put some standards in place, whether we could start to do commissioning. I think it's starting to work with the manufacturers, with the teams kind of that are supplying the clinical care, so you kind of Blatchford, Opcare, etc., and start to look at how could these things be used in your clinics. And if we can develop stuff in that manner, then it's less of a case of we've made this, here, have it, but working together to go, how would this be useful to you, and then implement something that has come through and is available in a way that people want to use it.
Great. Well, thanks very much for speaking to me today. I really appreciate it. Take care.
It's okay. Enjoy.